Hello, I'm Dr. Pizzadili. I'm back with my Happy Outcomes for Cancer Patients series, number 3, metastatic breast cancer. This case report is from the book, One Man Alone, an investigation of nutrition, cancer, and Dr. William Donald Kelley. It was written by Dr. Nicholas Gonzalez, completed in 1987, and published in 2010 by New Spring Press. And this research was supervised and the cases verified by Dr. Robert A. Good, who at the time was the director of Memorial Sloan Kettering Cancer Center, one of the preeminent cancer research and treatment centers in the world. Patient number 3 was a 62-year-old female, and she was still alive and healthy more than 10 years after her diagnosis of metastatic breast carcinoma. Now, for anyone that doesn't know, metastatic means that the cancer is spreading. This is otherwise known as stage 4. Now, this patient had a long history of benign breast disease, and she'd even had a biopsy in 1973. In June 1976, she had a new mass in her left breast at the old biopsy scar. In August 76, a mammogram revealed a suspicious lesion. So the patient was admitted to Iowa Methodist Medical Center. September 76, biopsy showed intraductal carcinoma. So patient number 3 had a left modified radical mastectomy. We're getting very serious here. They found a tumor 3 centimeters in diameter with comedo-type carcinoma and focal areas of necrosis, both signs of aggressive disease. Even worse, they found 10 out of 17 lymph nodes tested positive for cancer. Very grim. The patient was discharged from the hospital and immediately began chemotherapy with 5-fluorouracil as an outpatient. And she developed the expected consequences: severe fatigue, diminished appetite, rapid weight loss. Then she had a chest x-ray that revealed metastatic malignancy in the lungs. This lady is not getting better. So as she worsened, she decided to investigate alternatives. In November 76, after completing only 2 months out of a year-long 12-month protocol, patient number 3 refused further chemotherapy. She then traveled to Winthrop, Washington, a 2,000-mile journey each way to consult with Dr. Kelley. And I've seen her chart notes, and they describe her as very ill, going down the drain very quickly, close to death, and barely able to walk into Dr. Kelley's office. Well, after that consult, the patient returned home and began Dr. Kelley's program of nutrition, detoxification, and pancreatic enzymes. And instead of continuing her downhill slide, over the next several months, her appetite improved. She gained weight, and many other symptoms resolved. And so then, nearly 11 years after starting Dr. Kelley's program, she's still alive and she enjoys excellent health. Now, she was initially diagnosed with breast cancer, metastasized to multiple lymph nodes and her lungs. The number of positive lymph nodes is the single most important prognostic factor for patients with breast cancer. And with 4 or more positive nodes, the survival ranges between 14% and 27%, and she had many more than 4. Patient number 3 had brief chemotherapy, only 2 months instead of 12, but single drug chemotherapy has never been shown to cure metastatic breast cancer. There is a study of 1,263 patients that showed only a 26% response and no long-term survivors. So this patient was clearly dying when she began Dr. Kelley's program. And her incredible success can only be attributed to Dr. Kelley's program of nutrition, detoxification, and pancreatic enzymes. So ladies and gentlemen, here we see yet another case where under conventional cancer treatment, the patient faced pain, misery, and early death. Then they chose a non-toxic alternative and got a much different outcome. Health was restored, and they lived and enjoyed life far beyond all predictions. We must remember, conventional cancer treatment industry is focused on shrinking tumors and not on restoring health. Conventional cancer treatment is extremely toxic and risky. We know that chemotherapy and radiation themselves cause cancer. And we know that surgery and biopsies themselves spread cancer. Instead of applying chemo and radiation and hoping that the cancer dies before the patient, we work together with you to restore health, strength, and vitality so that your body rids itself of the cancer. So here's an important question. Are you doing everything possible to recover your health? To survive cancer, you must establish these foundations. An optimal body pH, that's your acid-alkaline balance. It's well established that all the enzymes, all the chemical processes in your body depend on the right acid-alkaline balance. And most of the people I see, especially the cancer patients, are way out. We must balance hormones. We're in an epidemic of hormonal cancers. Breast cancer, uterine cancer, ovarian, testicular, prostate cancer. There are too many people suffering the hormonal cancers, and we want to restore hormone balance. We must detoxify your body, mind, and emotions. Many cancer patients are walking around with a mindset of, oh my God, I'll never get over this. It's hopeless. It's the worst news. I mean, really, to get a diagnosis of cancer is about the worst thing anyone can ever tell you. We work to help change that mindset and that emotional set to realize the possibilities of getting better. It may be the biggest obstacle to healing. We must eliminate infections. Very often cancer strikes when the body's immune system is exhausted from fighting long-time chronic infections. One of the leading causes of liver cancer is chronic hepatitis C. We must rejuvenate depleted organs, glands, and systems. The #1 risk factor for cancer is aging. And folks, that means anybody over 40, because after that age, we actually become depleted of the essential nutrients, the essential enzymes that run our body processes and keep us healthy. And then we must use the best proven cancer-fighting nutrition. There are nutritional items that have been shown to kill cancer cells, but they're sadly lacking in most people's diets. They're already out there in the food. They already exist in nature, but we're not getting them. And so people end up with a cancer diagnosis. What's very sad is that chemo and radiation make all those important health factors worse. Now, I'm not going to be your MD or your oncologist. And those treatment decisions are going to be between you and the prescribing doctor. I do not diagnose or treat cancer. I don't do what the MDs and oncologists do, and they don't do what I do. I will work together with you to restore health so that your body heals itself. These patients in my Happy Outcome series had the courage to take their fate into their own hands. Many did so in spite of opposition from their medical doctors and in some cases from their families. But they enjoyed recovery and health completely outside anything seen in conventional cancer care. So ask yourself again, are you doing everything possible to recover your health? Think of your family, the people who love you and want you around. Are you doing everything possible to protect yourself and them? So if you have cancer, get help. Call my office, 907-272-6299. I look forward to seeing you, and I look forward to making your health and your life great again.